If you were watching this video, you were probably referred by your primary eye care provider, whether it's an optometrist or ophthalmologist, for droopy upper lids called ptosis or dermatochalasis. Just wanted to give a quick info video, and we'll send you some information about this as well, just so you're a little better informed before you come into the office. So my name is Sumit Jindal. I'm one of the surgeons here at NCO Eye Center and Geofacial Cosmetic Surgery. Our other surgeons are Dr. Samantha Prabhakaran and Dr. Vinod Jindal, who is my father and founder of the practice. And droopy lids is one of the most common things we treat. My fellowship training's in oculoplastic and facial cosmetic surgery. And in many cases, these droopy lids can affect your vision. Now, the way it can affect your vision is twofold, or threefold really. So one is true ptosis, which is the muscle in the upper eyelid starts to get weak and starts to fall down and cover part of your vision. So that is not a skin issue, that is a muscle issue. And the way we correct that is by doing a ptosis repair. And a ptosis repair is done either by tightening the muscle from the outside of the eyelid in cases of severe ptosis, or internally on the inner part of the eyelid for smaller amounts of ptosis that can still be impacting the vision. Next is dermatochalasis, which is extra skin on the upper eyelid. Dermatochalasis means that this extra skin here can be a small amount of skin that you just don't like and it makes your eyes feel a little heavy, or it can be a severe amount where it's hanging in front and falling over the eyelashes and covering part of your vision. And then the third is something called brow ptosis, which is just fancy talk for droopy brows. And your brows can start to fall down and push extra skin onto the eyelid. The vast majority of patients who, especially as we get older, but also genetically, can have lower lying brows that can cause hooding. Any extra skin you see go from the corner of your eye out is coming from the brow, most likely. And so to correct that, we do what's called a brow lift or a brow reset to get the weight of the brow off of the eyelid. And there's a lot of different techniques that can be used for that. So then comes everyone's most important question is, what does insurance cover? So insurance coverage has gotten tougher and tougher for droopy upper eyelids because medically necessary upper eyelid and brow surgery is different from cosmetic surgery for upper eyelid and brow ptosis, though there's a lot of overlap between the two. For insurance to cover a part of your procedure, your ptosis needs to be within 2 millimeters of the pupil. So that's one key characteristic, and that's why insurance companies make us send in a photo of you prior to surgery so they can see that indeed your lid is covering part of the colored part of your eye and down within 2 millimeters of the pupil. The other test we need to do is something called a visual field test, and that's where a bunch of dots flash on a screen, and we take it once with everything relaxed and drooped down, and we do it a second time with everything taped up. And that shows the insurance companies an objective measurement that your visual field improves by at least 30 degrees by lifting the lids. What we can most commonly get approved is the ptosis or the muscle tightening portion of the upper eyelid surgery. Extra skin on the upper eyelids is rarely covered at the same time as the ptosis surgery. So what we do to help patients, because most people want to get rid of the extra skin and tighten the muscle up at the same time, because the skin is what's bothering them more than the muscle, is we have just special discounted rates for doing an upper blepharoplasty, which is the technical term for removing the extra skin on the upper eyelid and contouring the fat bulges up here that can push down on the lid. So we have special rates for that for patients who are able to get insurance to cover the ptosis portion of their surgery and do an upper blepharoplasty at the same time. Now the brows are extremely tough to get covered by insurance companies because I've especially recently had a lot of trouble, or it's been pretty much impossible to get them both covered at the same time. So usually we have to do their upper lids, let the patient heal up, and then if the brows are still causing issues, we have to redo the tests and do the brow lift as a second session afterwards. Some patients, it may be more of just a brow issue, not an eyelid issue, where their brows have fallen, or maybe they've had their upper lids already done somewhere else and it's just a brow issue. The two variations of brow lifts we can get covered by insurance is one called a direct brow lift, where we make an incision that hides along the eyebrow hairs, and lifts the brow up. The other one is when we're making an incision along the hairline here, just to get the lateral part of the brow up. The goal, again, if insurance is partially covering the procedure, is not to get rid of all the wrinkles, not to get rid of all skin excess, not to get the best overall cosmetic result, even though we're going to do whatever we can to make things look pretty and get you a good cosmetic result. But the techniques that we can use when it's covered by insurance are not necessarily the same equipment and techniques we can use when we're doing things for cosmetic purposes. For example, an endoscopic brow lift, which allows us to do some contouring of the central and lateral brow, is considered a cosmetic surgery. If you have a tiny bit of extra skin up here or a little bulging fat pad, that is typically considered cosmetic. And then under eye bags are always considered purely cosmetic because they don't cause any sort of vision issues. You may feel them, you may not like the way they look, but many of our patients choose to get their under eye bags done at the same time. That's called a lower blepharoplasty, where we go either from the inside or the outside of the lower eyelid to get to these fat bags, reduce them in size, and either do some laser or remove a little bit of extra skin from the lower lids to get you a nice cosmetic result. Downtime after these procedures, I always tell everyone you're going to look worse than you feel. So it's going to look like you just got into a fight. Your eyelids will be bruised, they will be swollen, but it won't be a painful recovery, just an annoying recovery. Just from the swelling, your eyes will feel a little dry and irritated. But I've never had to prescribe a pain medication after one of these procedures. So you just use a lot of artificial teardrops and ointment that we prescribe. And usually about 7 to 10 days later, we say you can put some makeup on and not look like you just got into a fight. If you want to see some representative before and after photos for our clinic, you can see some on our website, which is www.ncopt.com. That's spelled OPHTH.com. If you go to our cosmetic website, which is giacosmetic.com, and each of those clinics has an Instagram page that has a lot of before and after photos, a lot of informative videos where we kind of go through cases and talk about them. You can see a lot of examples there as well. In terms of where we do the procedure, the vast majority of these are done in our clinic, in our accredited operating rooms. Most patients, when they're just doing upper lids, do them awake under local anesthesia. So you take a little Valium beforehand. You do feel the pinch and burn when we're numbing the upper lid. After that, you mainly just feel some heat or pressure. If a patient wants to be asleep, we don't do any general anesthesia, but we can do, if insurance is covering a portion of the procedure, we do the procedure at Blue Ridge Surgery Center, where you can get some IV sedation and get to be asleep for your surgery with just a gentle IV sedation, just like you're getting a colonoscopy or going to the dentist. If you're doing any cosmetic surgery at the same time, then we are usually able to get the IV sedation done in our office setting, since we're able to cover that through the cosmetic portion of things. So yeah, if you think of any other questions before your appointment, hopefully this video helps give you a little bit of information. But check out our websites, check out our Instagram pages to see some photos and things. And we are looking forward to taking care of you, making sure that you stay safe, get a natural, healthy result, and make you happy. Those are 3 main priorities, and that's what we want to do for you. All right.